Oh, I see a whole bunch of faces or
Yeah.
names now. I didn't realize there was all these people here, guys. I apologize. Hello to everyone else here. I could only see 3 at the top.
Well, that's because we just started the meeting. So, hi,
Okay.
everybody. Thank you for joining us. Sorry about the delay. We're having actually a little bit of trouble getting one of our presenters into the call. So I'm gonna get started, and then I'll ask the ones that we're not having the issues with to start, and then I'll work out in the background to make sure that we get Rod in the call with us. So first of all, thank you so much for joining us. Today is going to be an exceptional conversation because we are focusing the conversation entirely on the patient perspective, exploring CAR T therapy not through the clinical data or the scientific advancements, but through the real world experiences of those who have lived it. And as many of you know, CAR T is a groundbreaking treatment, but what does it actually mean for the people undergoing it? What are the challenges in accessing it? How does the journey impact patients and their families? And what happens after treatment? And so in this discussion, we're going to hear firsthand from people who have experienced CAR T, what worked, what didn't, what needs to change. Their voices are critical in shaping a more patient-centered approach to CAR T care, policy, and innovation. So thank you for joining us for this important conversation. My name is Sabrina Hanna. I'm the Chief Change Officer at the Cancer Collaborative, and let's begin. I am joined by Camille Leahy, hopefully Rod Delaney, and Joanne Wells. So hi, everybody. This is the first time I've had an exclusive panel of just people with lived experience. I'm really looking forward to our discussion. For everyone joining us live today, please feel free to ask questions in the chat box. There will be some time reserved at the end for a Q&A, but because we don't really have a huge live audience, and we'll see if we can work it out to make it a little bit more interactive, and I'll see if I can get your mics on so you can ask the questions directly. So to start, Camille, I will ask you to introduce yourself first and share a little bit about your experience.
Yeah, hi. So thank you, Sabrina, for asking me to be here. So my name is Camille Leahy, and I was diagnosed with acute lymphoblastic leukemia in January of 2020. So did you want me to do just an intro right now?
No, good. Tell us your story.
You want my story? Okay, so um, I had been unwell in 2019. I was on a sick leave from work. I was frequently getting infections, was under a lot of stress, was hoping to leave a toxic job. Um, until the end of 2019, I began feeling really unwell, and I began having dizzy spells. And I actually had a tooth removed not long before that. So I thought that maybe it was just something to do with my healing. Eventually, I'd had enough. I went to the Emerge, and I was told that I would need a blood transfusion, that my hemoglobin was very low. Um, so I was thinking it was just low iron that seems to run in my family. I thought maybe after the blood transfusion that I would be fine. Um, they said that I needed to stay another day. At this time, the hospital was really, really full. Like, it was flu season. They didn't have room for me anywhere, so they put me on a stretcher in the middle of the emergency room, and I just waited there. And I was visited by a hematologist who said, um, "We think you have a blood infection or a type of cancer called lymphoma." And I don't know if Sabrina, like, there's parts of the story that not many people know, but he actually told me, he said, "Don't worry, but I don't think it's acute leukemia." It wasn't until I was admitted that evening, and the next day I did a bone marrow biopsy, and then the following day they came to inform me that it was acute leukemia and that I would have to begin treatment right away. Um, Clearly, that was quite a shock. I went from not knowing what was wrong with me to finding out I had cancer, and finding out that I had to be at the hospital with as soon as a bed became available, and that I would be there for about a month doing what they called an induction. Um, the doctors explained to me that the normal protocol for the type of cancer I had was like that my cancer was quite treatable, ALL. The original protocol that I was given was to do the induction, clear the cancer, and then there would be 2 years of what they called like a maintenance chemo. So I would partner with my local hospital and do it like that. Unfortunately, after the month of induction, which was pretty intense, I they told me that the cancer wasn't gone and that the induction did not work. From there, they told me that they had a drug called blinatumomab, and they told me that because this drug was quite hard on the brain and can cause, neurological type issues, I had to remain in the hospital for another month. So I was at Princess Margaret for all of January 2020. I got to go home for a weekend and then started the blinatumomab right away in February of 2020. Now the blina is a constant infusion. They have to continuously keep you on it for a 28-day cycle. The only time that you're unhooked from that machine is to switch the bag to put a new medication on. Now that was also very difficult because now I'm attached to this. Like that's my permanent machine. Um, After that month, they told me that the blina was successful, that it cleared my cancer. I was so excited to get going home. But as you all know, at the beginning of March of 2020, we entered a worldwide pandemic. So they said that I could go home. So I got to go home. But before I went home, or when I had gone to an appointment, they approached me and said that through the testing that they did, that they believed that my cancer was aggressive and that it would likely to come back. They said that I could go home for a month, that because I tolerated the blinatumomab well, that they would let me do the blina as an outpatient. So what I would do was I was constantly hooked up to a machine, portable, and then every week I would go once a week to Princess Margaret for bag change. But at this time, while I'm doing this second round, they told me that they think that stem cell transplant. Sorry, guys, so they told me that the regular treatment they didn't think would work for me and that I would require a stem cell transplant. Now, remember, we're in the middle of a pandemic and nobody knows what's going on. At this point, I'm not allowed any visitors at the hospital, so I was very grateful to be home for that month. But now we are having trouble finding me a match for my stem cell transplant. I have 3 siblings. Unfortunately, none of them were a match. And I'm not sure if there was some type of issues with the donor registration because of what was going on in the world at the time, but we weren't ever able to find a perfect match. So I had 2 options. They found 2 what they called like 9 out of 10 matches. They found what they said that there was one that they would like to go ahead with. I agreed. I went through all the testing, went ahead with my stem cell transplant in July of 2020. Again, still in a pandemic, so I spent all of July 2020 at Princess Margaret again, but at this time I didn't have any visitors. I was alone for those that month. But after that month of hell, I'm sure anyone who's had a stem cell transplant here knows that I I fought to get stronger that month and finally got to go home to see my daughter and begin my healing and what I had hoped was, my new life with my new donor cells. I was beginning to get stronger. I had lost a lot of muscle. I wasn't able to walk at the time. I was using a cane, a walker, because of all the steroids. And one morning I woke up with some neck pain, not thinking, it's anything serious. But the next day, the pain started radiating through the rest of my body, from my arms to my legs, and it became pretty bad. And I knew it was time to go to the hospital. So I went to Toronto General Emerge. Finally got in, and they did just blood work. And unfortunately, just by the blood work alone, they were able to tell me that my cancer was back. And I knew that if they found it just with a blood test and not a bone marrow biopsy, that it must have been pretty bad and pretty aggressive. So was visited by my transplant team. My transplant team informed me that Princess Margaret didn't have any options left for me. And their stem cell transplant team didn't have options left for me and sent me back to my leukemia team. From there, I was offered another like induction type protocol called inotuzumab, or no, not inotuzumab, sorry, hyper-CVAD. The doctor had listed off a lot of these chemotherapies that were in this protocol, and they sounded really familiar. And I realized that they were a lot of the same drugs that I had done at the beginning of my journey in January of 2020. And I knew that at this time, with no visitors, not being able to see my daughter and not having support, I knew I wasn't going to live through another month of chemotherapy, and especially being by myself. So I refused the chemotherapy and I said I didn't want to do it. And my hematologist at the time, Dr. Minden, said, okay, we'll try something else. So we applied for the blinatumomab because we knew that it had originally had put me into remission. So we thought right now, well, like we know that it works anyhow, so we'll try to, do that again. I was denied that medication. So now I'm laying in the hospital dying alone, not knowing, like I've refused chemotherapy. Then I was offered another drug called inotuzumab, but the criteria to be able to get that drug approved, you had to be an outpatient. But I was so sick. But we didn't have any other options. So I was discharged, approved for that drug, inotuzumab. But while awaiting to get discharged for that drug, I recalled a conversation that I had had with a visiting doctor during my stem cell transplant preparation. His name was Dr. Jonas Matson, and he is at Princess Margaret Hospital. And I don't remember exactly what we were talking about, but he said, Camille, if this stem cell transplant doesn't work, there are other options out there. But at that time before my transplant, I assumed that was my cure. So that was kind of tucked at the back of my head. But when I'm laying there dying and, somebody tells me that we're out of options, that like the only thing is this chemo that I didn't respond to, and I knew I wasn't going to be able to handle again. And thank God that memory popped into my head. And I asked another doctor about CAR T cell. I said, hey, like, what about this CAR T cell? I must say, like, the stars aligned at that time, because she looked at me and said there was a clinical trial that had just started in Ottawa. And as soon as she said Ottawa, I'm like, well, oh my gosh, I have a family member who works at the Ottawa hospital. Now, I didn't think that she worked at that hospital, the general campus that this trial is being held at, but it just so happened she did. And so from there, I was pretty determined. I just had this gut feeling that I needed to get into this CAR T cell trial, that this was going to be my shot. So she looked into the trial, but I went ahead and started researching. I emailed the doctor in charge of the trial, Dr. Kekri. My cousin Jenny, or my cousin's wife Jenny, who worked at the Ottawa Hospital, also emailed Dr. Kekri. She had attended a online webinar with Dr. Kekri in the hospital that she randomly happened to see, and started asking questions about how I was going to get into the trial. In the meantime, I guess my doctors did refer me to this treatment trial, and Dr. Kekri did reach back out to me and told me that the reason that she hadn't reached out to me was because she was discussing with the team to see eligibility. Now, the eligibility, or part of the criteria for the clinical trial that I was in, the CLIC-19, was to have active disease. But we had to treat my leukemia at the time because it was so fast and aggressive. So long story short, guys, we're getting there. So I was accepted into the trial, and I don't want to go on forever, but I had a really hard time getting into that trial. I made 3 attempts to get out there. I don't know the order of exactly what happened, but I know I think right before the cell collection day. So for those of you who don't know, cell collection, they were going to collect my cells, send them away, modify them, send them back, and then infuse them into my body. But the night before that day, I had some numbness in the lower right side of my face. And while doing the rest of my intake and getting all the stuff together, I mentioned it to the doctor. And as soon as I mentioned that, she said, we need to do some testing. I could tell that something was wrong. We did a lumbar puncture that confirmed at that point that the cancer now had gone into my central nervous system. So it was like I would go up and then I would go back down and then I would go up. I don't know how we did it, but we managed to clear that cancer. I was sent back to Toronto from Ottawa. I, again, determined to get back there. I was even told that they wanted to put an Omiya reservoir into my head. It's a port that they can put chemo in, but it would have stayed in my brain. It was like brain surgery because they were having difficulty doing my chemo through lumbar punctures. I'm one of those patients that for some reason everyone says, "Oh, I've never had a problem before." But, and that's not nice when you have a giant needle being dug into you and they're going, "Well, this has never happened." So you can imagine anyone who's been through that torture. We found somebody who was able to do it, and I'll be forever grateful to her. So we cleared up the cancer, and there I went off. I was getting ready to get back to Ottawa. The night before I was supposed to go back, I had a fever that would not go away. And I knew that if I went to my local emergency room in Toronto, that they were going to admit me and that I wasn't going to make it to Ottawa. So I called my cousin Jenny, who works at the ER in Ottawa. And I said, "Jenny, are you working?" And she said, "Yes, I'm working tonight. I'm working the night shift. Get somebody to drive you to the Ottawa general emergency from Toronto." It was the only thing I could think of that like they wouldn't be able to send me home if I'm already there. So I decided, and I was really ill. I knew something was off. We drove 5 hours while I was like, struggling with this fever, finally get admitted. And they said, "We can't go ahead with the trial." And they were actually, kind of giving me crap, going, "What were you thinking coming here?" And I told them, I wasn't going to, I couldn't live with the fact that if I had stayed in Toronto, there was a chance that I wouldn't be able to go ahead. Unfortunately, guys, they kept me there on antibiotics. I'm pretty sure they sent me home one more time. But anyway, I finally was able, they decided, they spoke amongst each other, and at one point, I don't think some of the doctors wanted to go ahead with the trial, but I had one that advocated for me and said, "Listen, she's going to die." I think at this point we had already done cell collection. And basically what I was told was someone advocated and said, "Listen, she's going to die either way. Let's just try." And I'll forever be grateful because on September 15th of 2021, they put those infused cells back into my body. And this past September 15th was now 3 years without cancer. Now, guys, I'm cancer free. I have a lot of other type of things. Health wise, I do have congestive heart failure. I have low platelets, low immune system, but compared to the hell that I went through, I'll take what it is that I've been dealt with. And I don't believe that these side effects, the congestive heart failure anyway, I don't believe was CAR T cell. I think that was all the radiation and the chemotherapy and all the I had pulmonary embolism. There was a lot that had gone on during my treatment, but yeah, I'm cancer free. So that's the main thing. And I'm sorry that it went on long, but I know that there's certain parts of my story that people need to hear, so that they know you sometimes just can't give up. You got to keep going. So thank you.
Thanks, Camille. I think that's really the reason why I wanted to have you on today, is because you have that story where it's a prime example of how policy doesn't meet real world need. And thank God that you advocated for yourself, and thank God for cousin Ginny's, because we don't know where you would
have been this way. And this is why I thank people like you, Sabrina, who are helping it get out there, because people would be so surprised. My family doctor, half them have never even heard of CAR T cell or any type of cell therapy, and that boggles my mind.
Yeah. Hopefully we can get Rod to tell us his story.
Can you hear me?
We do. Yay,
Yay!
Oh my God.
success.
That's a good outcome in itself, isn't it?
It really is.
Camille, that's a great story. You must have some Newfoundland blood in you. You're quite the fighter. Well done.
Oh, I have to tell you something. Cousin Jenny is a Newfoundlander, and she had only been in Ontario for about 5 years at that point.
I knew we spread the wealth. We pass it
She's
around, and
my
there's a good reason.
angel. Yeah, this is amazing. Yeah,
A great
can't
story.
wait to hear your story, Rod.
Well, I mean, there are some similar challenges, but I guess I put together a little cold notes version. I'm just fighting through some red eyes now after listening to yours, Camille. It's a great story. Thanks for sharing it. Mine starts about November of 2012. So back at that time, I had a lump in my armpit that was progressively getting bigger and bigger and bigger, and so you go down the natural steps, of course, of seeing your family doctor and getting all the tests in place. And I remember something similar to what you were saying at the beginning about this is not cancer or something to that effect. And the radiologist who was actually doing the test on me, an ultrasound test on me at the time initially, the very first test I had outside of blood work, was saying that this is not vascular. This doesn't look like cancer to me. Now he wasn't supposed to say anything like that, of course, in the room, but I guess he was trying to give me some kind of positivity that at that time it just didn't look like something that I was there for. Anyway, we'll go back or we'll go ahead about a week or so when some more tests come in to my family doctor, to my GP. And he actually looked at me in the waiting room and he said, I don't know what's going on here. He said, but I really don't think this is cancer. So I'll take that optimism and move forward to probably a month or so later that we'll take all those initial responses and pitch them out the back door. Rod, you have cancer, full stop. The initial diagnosis, and Joanne's going to correct me, of course, as we go along, and rightfully so, was non-Hodgkin's follicular lymphoma. And that was in November of 2012. But that, after a series of chemotherapies, some radiation, as time goes on, the cancer transformed and it turned into the diagnosis of an aggressive diffuse large B cell lymphoma. So that's what takes us to our CAR T journey. Up leading up to that point, 2020, I'm March the 9th, and I remember it very well because my birthday is March 11th. We're in Halifax being assessed for a stem cell transplant. And it's funny, when you talk about your siblings, Camille, my brother was tested as well to be a donor for stem cell, came back as a negative, and you'd have to picture the look on my mother's face when I told her that that failed, and she wanted to know why. And I said, well, I guess, Mom, my brother and I aren't related. That didn't go over well, trust me. Anyway, I looked at Mom and I said, no, that's not the case, of course. It's just, as you pointed out, sometimes those connections just can't be made medically. So we had to look for donors. I received a bone marrow stem cell transplant in Halifax of September 2020. And it took that long to get it because, as we all know, in March the 9th was when we were in Halifax for the assessment. If it March the 10th, if not the 11th, the country got shut down. So my treatment or my transplant at that time was pushed up right up into September. So to September of 2020 in Queen Elizabeth II Health Sciences Center in Halifax, I received a stem cell transplant, and then I think Joanna was 6 to 8 weeks of isolation in the hospital. A hurricane came through. Um, I wasn't that hurricane, of course, but yeah, it was a different time. I the isolation in itself was quite challenging. But at the same time, we pushed through it. I had great care. I had great hospital care. So there's a lot to be said for bedside manner. These guys really helped me a lot. And of course, Joanne was visiting whenever she was able to visit. Um, there was the 2 months of isolation was required, as we all know, post treatment. because we just have to make sure that no other infections come into play. As we know that getting to that point, you have to make sure that your immune system becomes virtually non-existent in order to accept a stem cell transplant. So we'll fast forward after that time. I mean, we'll keep in mind that I had to leave, myself and Joanne had to leave Newfoundland, Cupid's Newfoundland, which is about an hour outside St. John's, to make that journey to Halifax. We had to take what we were told for at that time to prepare for at least 3 months away. So 3 months of whatever life we could fit into a vehicle, along with our dogs, find somewhere to stay, make the arrangements of moving your entire world with you. And luckily for us, I think after 2 months, we were told it was okay to go home, Joanne. So I was lucky to experience that with no serious or very invasive complications. So things were going great. I mean, this is 2012. We went home end of October or sometime in November. And I mean, I'm like tickety boo. I mean, I'm telling everybody in the world, I'm great. I got this kicked. Cancer, what cancer? The hell with cancer. But then, I got this feeling in my groin. And that feeling in my groin was somewhat of a lump. But at the same time, I was wondering, because of biopsies, was this scar tissue that I was noticing? So through regular checkups, we noticed that the lump is getting bigger. And I remember lying on the table being examined by my doctor, and doc, there's something going on with the scar tissue there in this area. Like, can scar tissue grow? And he's just looking at me like I'm a knucklehead, of course. And does a diagnosis, and I remember the look on his face, going, "Oh boy, we got to dig into this rat." This was the fall of 2022. He confirmed a diagnosis. Rather, I don't know what to tell you, but the lymphoma's back. I actually seen this doctor yesterday who looked at me and through another point and said to me, he said, this is not a doctor-patient relationship. We're friends. He said, we've done this for a very, very long time. And why I'm raising that point with you is when at that time when he told me the cancer was back, I don't know who was more upset, him or me. It was a real kick in the backside. So he was along with that journey for me, of course. We had to recognize that, as I said earlier, the cancer had transformed to a more aggressive diffuse large B-cell lymphoma. We were doing some recurring treatments of chemotherapy, of course, and we came to the conclusion that the treatments in time between treatment to treatment was becoming shorter and shorter, which spoke to the bigger issue that this is becoming untreatable. The conventional treatments were gradually becoming ineffective, and my options were becoming limited, except for, and he brought it forward, there's a CAR T treatment that's starting to become much more popular, successful, great results coming out of it, and would we consider going to avail of this? So once we determined my viability, I mean, it was almost comical when we were doing the I can't remember what it's called, Sabrina, but the where you extract the stem cells, or not the stem cells, rather, the cells for re-engineering that Camille spoke of. What's that called again? Sorry.
The leukapheresis. I hope I
Absolutely,
pronounced that right.
absolutely. Thanks for that. I mean, as Camille knows, you're stationary on a bed for about 6 to 7 hours. You're not allowed to move. It's not unlike getting dialysis, tubes in one arm, tubes in another arm as they go through the process. And you're literally not allowed to move. So, for the sake of comedy, I mean, I had to use the bathroom. That was a little tangly too. So, the memory of that was 7 hours not moving, and the fact that we're just having fun in the moment. We were not letting this thing beat us down. So that was the experience of extracting the cells and collecting the cells and sending them away for the re-engineering. That was June of 2023. Then July of 2024, it was time to actually receive the infusion, and everything was looking great. This was in Ottawa, by the way. This involved another period of relocation, and this time we're going about approximately 3,000 kilometers from home. Imagine again that drive in a mid-size Volkswagen SUV, 2 to 3 months of our life in the back, and two dogs, one of which is over 60 pounds, and the other one that's a proud lap dog of 120 pounds, all in the back of a mid-size SUV. What makes this much more interesting is that I'm not healthy enough to do that trip. Joanne's the one driving behind the wheel, so the heavy lifting there alone was being experienced by somebody other than me as part of this experience, so that I get to live. I'm not sure how all that makes sense, broadly speaking, that my wellness was not only dependent upon medical technology and care, but the fact that we had to make the sacrifices that were being made just to get to Ottawa from Newfoundland. Um, thank God that there was a dear family friend from Ottawa that flew home to make that journey with Joanne. Um, Healthcare provided no funding assistance for this companion. So this was a dear friend of ours in Ottawa that actually out of her own pocket made this journey out of love for her friend and her friend's husband. And that's a big part of my story among all this, the medical piece, not accepting how, while my doctor cannot call me cured, he is looking at me saying, I wish I could, because you're as close to cured as anybody I've ever seen. My outcome has been exceptional. Cognitively, I have an improvement there. I mean, brain fog is a very real thing, as I'm sure we all know. Uh, I'm nothing like I used to be. I wouldn't be able to do this interview a year and a half ago like I'm being able to do it now. Everything's quite clear and concise to me, but at that time, leading up to all that, brain fog was a very real thing, and I'm very grateful for CAR-T, and I'm very grateful for everything that medical care provided. But to get to this point after initial diagnosis of 2012 and then a recurrence of 2022, whereby we had to go through chemotherapies and a radiation therapy, why CAR-T is not our first line of intervention here is just, you use the word boggle, Camille. I use it all the time. My brain is boggled in trying to figure this out, especially when we have such positive outcomes as we're coming through there now. Why did I have to go through 10 or 12 or 15, no exaggeration, even though I'm making that sound broad, instances of chemotherapy? How many people are in a hospital bed on Christmas Eve with an IV up to them receiving these chemotherapies with a snowstorm going on outside, when we could be doing CAR-T treatments and infusions and the immunotherapy and the success rate that's coming on? And Joanne will probably speak to it more, but it was something that Joanne raised with our doctors and our clinical teams years before, that we were being simply dismissed over. And I just think there needs to be a broader sense of understanding of how this is the first line of intervention in trying to make this disease tolerable is not the right word, to make it go away, to make it deal with, to be able to get on the right road to success. So it's important for me to understand how important support is, how important it is to be able to avail of care locally, because all the sacrifices made to get to this point, not only in the time that we experienced to get there, but personally, financially, mental health wise, it's reasonably avoidable, I think. And I think it's an important part of our story. Um, I could go on, Sabrina, but there's so much more that we can share here in the room here.
Yeah, and I'll segue off of something you said when you talked about you didn't just need to get your care from the medical side, but you also needed Joanne to be there to help you throughout that. So I'll take that opportunity to ask Joanne to introduce herself, and then, I mean, you don't have to go through Rod's journey, but I think from your caregiver perspective, maybe just give us some insight from that caregiver perspective, because you actually can't receive CAR-T unless you do have that caregiver with you.
Hello, my name is Joanne Wells, and I'm Rod Delaney's wife and caregiver. And that which is making me segue into something. I'm not a caregiver; I'm his wife. So yes, he had to have a caregiver to have this CAR-T, and the stem cell transplant as well, which in and of itself is a little intimidating because I've never worked in the medical profession. I have now. I do feel because Rod has been, battling cancer since 2012, that I am probably a little bit more knowledge than the average Joe. I'll take upon my own name now when it comes to cancer, only because I had to. We were told right from the beginning that there was no cure for Rod's cancer, which then put me, my back up a little bit. What do you mean there's no cure? So, I researched a lot. And a lot of times I would have things to ask the doctors about. But, I'm not going to say I was shut down, but I was shut down. And I understand a lot of that probably has to do with finances. And I'm going on a completely different tangent than you had wanted me to. I know. But as a caregiver, which was a label that was put on me, these are the things I started to see. I understand the expense of the CAR-T therapy, but I also understand the expense not only of our healthcare system, but the cost to myself and Rod financially, stretching out this cure for him. I mean, Rod has never gotten to 2 years with any treatment. We're not quite at 2 years yet, but I have never seen Rod look and feel as well as he is right now since 2012. So that's a long time. But as a caretaker, I think that I wish I had had a little bit more medical support or knowledge prior to being the caregiver for Rod. Definitely with the CAR-T. It was intimidating and it was scary, and I felt a little overwhelmed at times. Partially being in a city I didn't know, partially because I was really worried. Like if something goes wrong, what if I don't notice it? I had to monitor my husband, who, he's my husband. So when he's going through challenges, it's a husband and wife relationship that he's trusting that I'm taking care of him. But when things are going wrong in his mind, it's his wife who is turning against him, we'll say, who is going against what he thinks. So I think if I had had a little bit more, I don't know, support knowledge maybe on how to properly deal with the medical things that could have came up when I was the caregiver. And I don't mean his temperature spiking. There were some other variables that we had to deal with that, was a little intimidating for a caregiver. And again, it was more than just, is his temperature going up? So I think if I had have had, I actually met with a psychiatrist after the fact, just kind of sitting in with the conversation she was having with Rod. And I kind of went, wow, I wish I had had a chance to talk to her prior to me taking Rod home or back to the apartment we had rented in Ottawa in order to, care for him as we're going through that process.
Yeah, I think that that's a really interesting point that you bring up. And it actually was one of the questions I wanted to ask is what would you have liked to know before you received, or well, you didn't, but before Rod received the CAR-T, or Camille, before you received the CAR-T? Besides that educational, yeah, I mean, you mentioned that you would have liked that information, but is there anything else that you would have liked to know before you received the CAR-T?
Can't think of anything just off the top of my head. I mean, I just wish I would have known about it sooner, because maybe, but again, for me, it worked out because I told you the stars aligned. But yeah, I just wish I would have known sooner. But I also wanted to say about I'm not sure everybody knows, Sabrina, you know that there's now these machines that they've created, that these biotech companies have created to be able to manufacture CAR T cells hopefully closer to
Home.
wherever they're being, so to have it in-house. And they have them. They're working on them. It's just money, taking a lot of money to, and yeah.
Joanne, is there anything, or Rod, anything that you would have liked other than the educational piece? Is there, what support, education, information, tools would you have liked to have had before you received the CAR-T?
I'm just going to be a little quick with this. I mean, a lot of times I'm going to try to be really quick. Like in our example, and right now, the way things are in Canada, you can only get the CAR-T therapy in certain areas. So as an example, we showed up to get the evaluation in Ottawa, and we showed up on a Sunday. And by the time we got to our accommodations, it was really late. We couldn't even get anything to eat. We had to, there was no grocery stores in the area. And we did, I think, end up ordering, I don't know, Pizza Hut or something and getting it delivered to the accommodations. But, even things like we had to eat Pizza Hut at a time when I think, when people are struggling with cancer, and I think most people are really cautious of their finances when they're going through something like this. So, the fact that we had to, you know, sometimes it's those little things. If we had have known where there was a grocery store, I didn't want to leave Rod. So even to go out and do any exploring, when I've got my husband there and I'm the caretaker, sometimes it's just those little things. Even a basket of fruit in the room, which, we would have paid for if we had realized there was nothing in the area where the accommodations were.
Yeah.
So it was one less thing. So sometimes it's those little things that would have been a great support, I think, to me as a caregiver, so I could have been a better support to Rod. I mean, when I was taking care of him, and maybe I have a little bit of neurosis of worrying about a lot of things, but I couldn't even go to the grocery store in my mind because my job was to take care of Rod. And what happened if I took, a half hour, 45 minutes to go to the grocery store to get the food that we needed? If something happened to him while I was gone, these were some of the, things I think you just don't think about because, I'm worried about him. I do not want to leave him, definitely initially. So it was even things like doing laundry or getting groceries that became a bit of a challenge. And I had to make sure that he was eating properly and there was restrictions on the foods he could eat, which means a little bit more effort had to be put into the grocery shopping. So even, trying to use one of these grocery shopping services that deliver, I didn't trust anybody else to be looking even at what I was bringing home to him. So those little things I think would have helped me as a caregiver a little bit.
Yeah.
I just want to add a point to what Joanne's saying here. Camille, I apologize. I see your hand up. But just very briefly, what Joanne's not saying to everybody here in the room is I was experiencing some psychosis as a side effect here. So Joanne just wasn't confident that I could be left home alone, and rightfully so, because find me 2 blocks down the road in Ottawa. When we're from small town Newfoundland, guys, we really don't know where we're going. So all this was playing in a role in Joanne trying to do a job with her husband, a job as opposed to wife, the caregiver, the caretaker, to make sure I don't go completely off the rails. And a side note to the ordering with the online apps or the delivery, I got hacked. I'm home in Newfoundland, and I don't even remember the name, but somebody's trying to get thousands of dollars off in food delivered to their house. Anyway, Camille, over to you.
No, I just had some time to think about the question. Sorry, I told you I get flustered. But yes, many barriers, kind of similar. So I forgot to, I'm a single mom, so I'm her only parent since I was pregnant with her, and there's never been anyone else involved. So it's just been her and I. I did get a lot of help from my mom, but when I was diagnosed, um, I had quit my job of 17 years a week before I got diagnosed, and I was supposed to be starting my new job at the hospital I was diagnosed in. They didn't let me start the job. They withdrew the job offer. So I'm on Canada Pension still, thank God. When I was diagnosed, I was terminal, so they put me on Canada Pension right away. So got very lucky there. But I don't know what I would have done if, like, I have no family in Ottawa. Like, my aunt has 10 children. Her one child decided a couple years before I had CAR-T that they couldn't afford a house in Ontario. So his Newfoundlander wife and him decided to just pick a place on the map, and they picked Rockland, Ontario, which is about 45 minutes from the Ottawa hospital. Yeah. So I, so Jenny, she's a new mom. She had a young toddler at the time, an ER nurse at the Ottawa hospital, and now my caregiver. So they set up their basement for me, put a bed, and now remember, we're still in a pandemic. I know this is going to sound comical, but it really did happen. While I was recovering from my CAR T cell treatment, guys, the hospital went into, they had a Legionella disease outbreak. We had no water for over a week. And I know this might be TMI, but I'm not sure if anyone knows that's been in the medical that C. diff and people with low immune system is very common, and no running water. And yeah, it was pretty traumatic. But there was we definitely need more support for these caregivers. Even my daughter came with me to Ottawa the first time, but when I was sent back 3 times, by September, she had to go back to school or whatever they had going on at that time. So we kept her in Ontario, but if my mom wasn't off work, I don't know what I would have been able to do. And financially, I, again, without other people donating, skip the dishes, gift cards, and things like that, like there was a point at time they weren't even able to bring me food into the hospital during the pandemic. So, again, Rod, I think your and I's story, I mean, we have the extreme versions because we went through a pandemic. So I think that there's a lot of supports that maybe Rod and I maybe missed out on that were available to other people now or are available now. But definitely the 3 main things is support for the caregiver, because my mom tells me to this day, like, she's out in New Brunswick now, but she tells me to this day nobody was there for her. She had nobody. And I don't know if you felt the same way, Joanne, but my mom really felt like she was kind of abandoned. Especially now her daughter's in the hospital, she can't go visit, so now there's no one advocating for me either. So yeah. And I don't know about you, but the mental health afterwards, all this stuff, I think needs some improvement. Because I think as soon as we're, what they say, cured, it's kind of like, okay, now we move on to the next, which is great, but we still need supports after these kinds of treatments, I think, anyway. So yeah, I think we're lacking in those departments unless they've improved. But I had a question, Rod. Did you do the same? Were you in the clinical trial of CAR-T at the Ottawa Hospital, like the CLIC-19 trial, or did you do a commercial version of CAR-T? Okay.
Commercial.
Yeah.
Camille, we're a lot more aligned than you might think
Well,
because myself and Joanne ended up in Rockland as well.
wow.
That's where her friend was from that supported us.
Joanne, that's incredible. Wow.
Yeah, to your point about no help, 2 Newfoundlanders and their 2 dogs with the tornadoes coming through. Just picture the 4 of us trying to fit into that bathtub. Just trying to make sure that the tornado don't sweep us away. Left to our own devices, of course, no preparations whatsoever. I received a job offer the very day I was told you got to be in Ottawa a month later. I had to go back to the people that gave me a job offer and say, hey, guess what, guys? Thanks, but no thanks. And yeah, Joanne was left to her own devices. Joanne, besides her dear, dear friend, had absolutely no supports. And that's what, we're talking about everything involved to CAR-T, cancer, our health, being at the bottom, unhealthy, trying to get back on track. And all I can put out there is how little support there was for my caregiver. I was in a bed. I was surrounded by a medical team. Joanne was taking care of me away from the hospital, et cetera, et cetera. Who was taking care of Joanne here? And why can I not get that treatment or anybody else in Newfoundland locally? They're not as simply answered as I'm stating them. I'm not suggesting that they should be, But the fact that, how healthy was it for us to do that trip to Ottawa when it comes to your mental health, etc. And I don't mind saying here in this room, we're talking about retirement before I get this unwell, before CAR-T is even on the table. Well, we came probably within a week of declaring bankruptcy and selling homes.
Hmm.
And where was the supports for us at that time? Everybody was doing the best they can, but really, we felt isolated. We did.
Yeah.
Joanne, I don't know if you want to add to that.
Well, I was going to say, Rod, and that's it. Now we're left to pick up our lives and expect everyone expects it like, oh, well, you're cured now, so get back to it. Well, there was a whole life that didn't happen because of what happened to us. So
I exhausted
the
everything I had.
directions have definitely changed, I think.
You talk about food service being your background. That is my background. I did everything I could to save money, as did Joanne, of course. Joanne always bragged, "Hey, Rod, you got to go to work. I want to be a kept woman." And now we're to the point now, you know what? We're so happy. We got everything put behind us, and we'll get on with it. Could it have been better for many different other reasons? And Joanne's got so much more input on that than I can possibly give context to.
Yeah. So unfortunately, we're starting to run out of time, and I wish I would have scheduled this a little bit longer. But maybe you can all just talk to, having gone through that experience, what would you like to see differently for other people who may go through or who will receive CAR-T?
There's so much to add here. Everything
Go
I'm
ahead.
putting out there right now is all about the the prep to get there, everything involved while you're there, the supports while you're receiving for caregiver and patient alike, and then aftercare. You know, we basically, it was just as well we started our lives over again for everything that we had to go through. We worked so hard to do everything right and by the book to get where we were before these treatments and the imposition on our lives that it became. I mean, there was a huge imposition here. I can't help but go to talk about the financial aspects of it all. It's just where my focus is. Joanne may well want to talk about the emotional and the mental stresses that are involved. Camille, your experiences as a single mom, how are they not as important to be considered for anybody else going down the road? There's just so many variables at play here. That's not a direct answer, Sabrina. There's just so many variables that really need to be taken into account to provide the proper care that we have to be well in order to get well, and or vice versa. And it's complicated, but at the same time, if we tackle it head on and think of it but much more broadly, then it shouldn't be that complicated.
I mean, go ahead.
No, I was just going to say, I know that they're working on it, but the obvious is, yeah, travel, like accommodations, support for caregivers, access to nutritious food. You know, they might sound like little things, but these little things definitely make a big difference. Yeah, just the travel alone. And if my social worker was, thank God for my social worker, but I don't think all social workers are as helpful as mine, but they filled out my ODSP, my CPP forms. There's a lot of people I speak to that don't have any help and don't even know where to go. Like, I also didn't know that they covered transportation for medical appointments until after a year of my mom driving me back and forth, which, yeah, it's,
Wow.
yeah, more awareness for supports that we have the ability to access ourselves, but we just don't know about them. So, yeah, maybe a patient ambassador at every I think they have something like that, but you know what I'm talking about.
Yeah. Or at least one patient ambassador specific to CAR-T that can, where whatever part of the country you're in, can help you. Like you can get access to this. You like get a place here. There are grocery stores here. Like somebody who can help you navigate all that, but specifically to CAR-T.
Oh yeah, because in Rockland, Rod and Joanne, there's nothing in Rockland. You have the little stores, but like if I needed something, I had to send them out into town to get something specific. Um,
We actually
We were in the
bought a
trailer
dog.
park.
We stayed in Ottawa, but only for, but that's going to how I would like to end things from my perspective. And I know I'm taking it a step further, but we're given this platform now to do that. When we went to Ottawa, we were given an apartment, and it was probably one of the most, and we couldn't have our dogs there. So my friend had said she would take the two dogs while we were staying in Ottawa and getting the treatment. Rod worried about the finances, but at the time, I didn't. I was worried about Rod being cured. And it was probably one of the most depressing places that I had ever stepped into. And all I was thinking about was, okay, so Rod is going to come back, be confined to these four concrete walls with, it was such a depressing environment. So, much to his chagrin, I took it upon myself to go and find a place. And I found a place. It was a little smaller, but you know what? Had windows, it had light, it would let us take the dogs. And it was more inspirational for Rod to actually have to come back and be confined into that space. So I think even things like that can help with with all patients getting better. I mean, can you imagine trying to heal and not being able to leave, and you've got like four cement walls around you, versus having a little patio you can sit out on so at least you can get some fresh air, having a window you can look out of. I mean, even those things are so much more important in the healing process.
We focus so much of the discussion around like the medical intervention that we forget about what is happening outside of the hospital. So this is kind of like exactly the reason why I wanted to have this conversation with you. I see that it is 5 minutes past 1. I'm happy to stay on and continue the conversation with you. And whoever would like to watch the recording will be able to do so. If you need to go, please feel free to go. Again, the recording will be available. If Camille, Rod, and Joanne, you'd like to stay another 5 minutes. So there are some questions I didn't get to ask that I would love to be able to ask. So if you're okay with us continuing, then I'm okay with that too.
I'm okay. My daughter's not starved yet. She'll be okay before I drive.
Well, we won't go on too much longer. Maybe just another
I'm
5
teasing.
minutes.
This is so lovely to be able to be able to have this conversation. I was nervous, but this is not like what I was expecting. Usually I'm doing these webinars and I don't get to share a lot of what I got to share with you guys, like those bits and parts of my story that to me are so important. But I know that's not what these people that asked me to go speak at these places are really looking for me to get into those kind of details. So it was nice to be able to share some of that. And there's so much more. And I'm sure same with you guys, Joanne, and like as you tell your story, you remember certain things that come up too.
Yeah. And so I think that was like exactly why I wanted to do this, because I had the opportunity to meet Rod and Joanne when we went to do a site visit, and we were able to have like they presented, but we were also able to have those conversations when they were not presenting, and I was able to meet you as well, and I heard your story, and I was able to hear.
I think I met you a couple times. Like I think you came to the documentary viewing. Is that where I first met you, or is that somebody else?
No, that's somebody else. We met at Healthy Matters, and you were talking about your story, and I heard you say CAR-T, and I jumped into
I
the
thought I had
conversation.
already met you, so
I bet it was over a meal, Camille.
There was food involved.
Definitely, yeah.
But so one of the things I would like to ask is, because you both received the stem cell before the CAR-T, and stem cell is not an easy process to go through. And I know, Rod, I think you said, like, why are you giving us all these other treatments when we can just have this? in first line. So maybe talk a little bit about that, because I think that that's such an important aspect, because stem cell transplant is also very expensive, but in some instances you have to fail stem cell in order to receive the CAR T. So the experience of the stem cell, like
Yeah.
even in comparison to the CAR T.
Well, if I did put them side by side, the CAR T was much more tolerable.
Oh, absolutely.
The stem cell was very intrusive. When I was receiving like the transfusion of stem cells, I actually went into rigors, Joanne. Uh, and that lasted about 10 minutes. We honestly, I'm sitting there in the bed, not anticipating this, watching everybody scramble because I'm shaking the whole hospital. It was that intense. Your bodily functions change after that. The fog again. I don't know how to compare it with a chemo fog, but there's a mental fog where your faculties just aren't the same any longer. And again, when it comes to the mental piece outside of this fog that I speak of, I have four walls around me, a TV, and nothing else.
Hmm.
So that in itself is very interesting about trying to get well then, because um, Joanne coming to visit was, and rightfully so, the highlights of my day. I'm not just saying it for the sake of saying it in this room, but imagine a television. And Camille, you get it, of course. A television, isolation in the room. Do not walk outside that door. I remember going out that door actually, and the nurse practically running at me and saying, "Get back in that room," and explaining to me why. This is a secure ward. You have no immune system. And the fact that you're even going outside this door is life threatening to you. And it was just an experience that just made everything extremely weird. Whereas the CAR T treatment, I received the transfusion, I was observed for a period of time, and been sent home into the care of Joanne. And that was like so easy for me, the patient. Joanne was the one making sure that I wasn't going off the rails. I was extremely difficult, and that's an understatement in itself of how difficult I was. And I remember very little. So Joanne won't embarrass me by saying just how bad I was, how difficult I was to deal with.
I see that there are two people who stayed on, and I'm just wondering if either one of them would like to turn their microphones off and ask either one of you a question. But in the interim, if they decide that they want to do that, I had a question that I wanted to ask, and it's slipping my mind. But
I'm going to have to go, unfortunately, because
yeah.
I have a work commitment.
Yes, go ahead.
And I have
Yes, and we're coming on to time. Yeah.
post-cancer bills
So
to
nice
pay
meeting
for
you,
now.
Joanne.
Yeah.
But listen, you have the two most important ones still here on your call.
No,
Camille,
well,
it was so lovely to meet you. Sabrina, I love you, and I thank you so much for everything that you're doing. And come to Newfoundland soon.
I promise. I
Sabrina,
will.
will you remember your question? Oh, sorry, go ahead.
No, I was gonna say I'm gonna end it here because it is now 10 minutes past. So I
Well, maybe we'll have to
appreciate.
do another one since we have so much to say. So this is great. I'm glad.
I think we do. I think we definitely do. We'll schedule it for longer for sure.
And maybe I can get Jenny. I know she just had a new baby, but maybe I can get another caregiver, somebody to join us as well.
I'll get my laptop.
Joanne support.
Wonderful.
Okay, have
Thank
a
you
great
all
day,
so
everybody.
much.
Thank you.
Bye.
Thanks, Sabrina.
Thanks,
Bye-bye.
Sabrina. Nice
Thank
meeting you.
you.
Bye, Rod. Nice meeting you.
My
Bye-bye.
pleasure. My pleasure. Bye bye, everybody.